Greetings everyone, I'm Theodora Adisti and I am a resident in Oral Medicine program at Jajaran University. In this presentation, I'm going to present my case report, Successful Treatment of Pemphigus Vulgaris in Elderly and Younger Patients by Assessing Clinical Outcome Holistically. Introduction. Pemphigus vulgaris is a chronic autoimmune disease that can affect the mucosa and skin, with a prevalence of lesions involving only the oral mucosa of 50.8%. This disease is more common in women and rarely found at a young age. Pemphigus vulgaris can be classified into two types, oral mucosa type and mucocutaneous type. Oral mucosa type has symptoms only in the oral mucosa caused by antidesmogently, and the mucocutaneous type they can affect the skin and oral mucosa with antidesmogen 1 and 3. A 22 years old female patient came to the oral medicine department with complaints of painful lesion in her oral cavity. The lesions show in her lips, labial mucosa, buccal mucosa, and tongue. She has lesion on her skin and has previously been treated in the Department of Dermatology and Venereology. The patient was diagnosed with Pemphigus vulgaris based on clinical examination from the Department of Dermatology and Venereology and the result of the biopsy from her hand. We assessed her pemphigus oral lesion intensity score, and the results show score of 21. Another patient, a 64 years old female patient, also came to oral medicine department with same complaint, but she didn't have lesion on her skin. The biopsy from her buccal mucosa indicated Pemphigus vulgaris. The results show suprabasal acantholysis, Thomson appearance, and Zhang cells. Her poly score is 16. The treatment aimed to reduce the POLI score, which means improve the quality of life and decrease the disease severity, also to maintain the patient's condition to prevent recurrence. POLIS is a disease severity scoring system to assess the severity of oral pemphigus vulgaris that combines both qualities of life assessment and clinical disease severity, which divided into 9 examinations with the lowest score of 0 and the highest score 36. With this method, we can assess the severity of the patient's lesion with Pemphigus vulgaris more objectively and holistically. Both patients were treated with systemic corticosteroid methylprednisolone. The use of systemic corticosteroid has been the mainstay to treat Pemphigus vulgaris and the first-line treatment during the initial phase of therapy owing to their rapid effect. The rapid therapeutic effect of corticosteroid is attributed to increased transcription and desmoglein and other cell adhesion molecules, which counteract the autoantibody-induced interference with desmoglein adhesive function. Both patients were also given corticosteroid mouthwash, vitamin D, and folic acid. The use of corticosteroid mouthwash is as an adjunctive therapy. Folic acid is given to patients to help heal the lesions, where folic acid plays a role in DNA synthesis and cell division. One of the side effects of prolonged use of corticosteroid is osteoporosis, with one of the prevention that can be done is giving vitamin D. Oral candidiasis is one of the side effects of using corticosteroid. Nystatin was also given to both patients as first-line therapy at the onset of oral candidiasis. Both patients show improvement in their lesions after therapy. Complaints and lesions in the oral cavity in the younger patients began to show significant improvement after undergoing treatment for 5 months. After 10 months of treatment, the patient was declared healed and still routinely monitored. The POLI score in younger patients was significantly reduced to 0 after being declared healed. Meanwhile, the older patient has been undergoing treatment for 3 months and have experienced significant improvement. This can be seen from the decrease in the POLI score to 5. In conclusion, the treatment of Pemphigus vulgaris is not differentiated by age. We conclude that the POLIS is a useful scoring system to assess Pemphigus vulgaris holistically, both quality of life and clinical disease severity. Thank you for your kind attention.